My name is Susan Hwang. I'm a neonatologist in the NICU, the Neonatal Intensive Care Unit at Children's Hospital Colorado and at University Hospital. I'm also an assistant professor of pediatrics at the University of Colorado School of Medicine and the physician lead for our state's perinatal quality improvement collaborative focused on care of the opioid-exposed newborn. Over the past several years, we've seen an astronomical increase in the percentage of women of reproductive age and pregnant women suffering from opioid use disorders. And subsequent to that, we've been seeing rapidly increasing numbers of infants that are suffering from neonatal abstinence syndrome due to fetal opioid exposure. In the past several years, there have been dramatic changes to the care of opioid-exposed newborns. Some of them include promoting rooming in of the infant and his or her mother, optimizing non-pharmacologic comforting measures, and if opioid therapy is indicated, providing opiate therapy on an as-needed basis instead of on a standing regimen. We've also sought to develop consistent criteria for assessing breastfeeding eligibility among women with opioid use disorders. We've also moved away from the Finnegan assessment of withdrawal and adopted the Eat, Sleep, Console assessment tool. And importantly, we also are attempting to optimize the safe transition from hospital to home for these high-risk infants. In our state, we recognize that the care of opioid-exposed newborns and their families varied across and within birthing hospitals. With little data collected and no platform for sharing clinical practices, it was unclear whether certain care approaches by some providers or hospitals led to better outcomes. Hospital variations in opioid-exposed newborn care have been associated with more pharmacologic treatment, longer lengths of stay, and higher healthcare costs. Moreover, recent publications by Drs. Grossman and Walkman provided evidence for novel approaches that could be implemented within a quality improvement framework. Given the rising rate of maternal opioid use disorders and prenatal opioid exposure, the Colorado Hospital Substance Exposed Newborn Quality Improvement Collaborative, or Chosen Quick, was formed in September 2017 in order to provide the infrastructure for sharing of best practices, data collection, analysis and reporting, and provision of quality improvement education, all focused on improving opioid-exposed newborn care. To date, our collaborative includes 25 birthing hospitals in Colorado, Wyoming, and Montana, with 13 hospitals contributing data to the centralized database. There are some limitations to this work. First, while nearly half of all Colorado births occurred in a Chosen Quick hospital, clearly not all opioid-exposed newborns were touched by this broad effort. Anecdotally, providers from some non-Chosen Quick sites have shared with us that care practices have changed at these sites as well, including the adoption of the Eat, Sleep, Console tool and optimization of non-pharmacologic approaches. However, data from these other sites are lacking. Second, this effort was a hospital-based initiative with outcomes captured at the time of discharge. Thus, post-discharge outcomes and experiences of opioid-exposed newborns, their families, primary care providers, and social service providers remain to be evaluated. While we consider the reduction in length of stay and percentage of opioid-exposed newborns requiring opiate therapy a short-term success, it is unclear whether the burdens of caring for these infants have shifted to families and to outpatient providers. Recent studies that have implemented ESC, or the Eat, Sleep, Console tool, and enhanced non-pharmacologic care have shown no increase in readmissions, but we have little data on whether other outcomes such as parental stress, infant feeding and weight gain problems, and frequency of outpatient pediatric visits have increased since adopting these novel care approaches. To address some of these deficits, Chosen Quick is creating additional partnerships with community and social service agencies to better understand the post-discharge experience of opioid-exposed newborns, their families, and providers. I would like to acknowledge our partners in this effort, Illuminate Colorado and the Colorado Perinatal Care Quality Collaborative. For more information, please visit our website.